Respiratory diseases. What is a respiratory disease? Respiratory disease is a medical term that encompasses pathological conditions affecting the organs and tissues that make gas exchange possible in higher organisms, and includes conditions of the upper respiratory tract, pleura and pleural cavity, and nerves and muscles of breathing.
Acute inflammation of the lungs, leading to severe respiratory problems, and is caused by bacteria, amoebae, viruses, fungi, parasites, or injury to the lungs.
The respiratory diseases range from mild and self-limiting like the common cold or life-threatening entities such as bacterial pneumonia, pulmonary embolism, and lung cancer. The changes that occur are that respiratory muscles become weaker, there's a loss of elasticity, and also chronic diseases develop. The symptoms are dyspnea, chest pain, cough, common cold symptoms, fatigue, congestion, and muscle aches. The classification. It depends on the organ or tissue involved, the pattern of associated signs and symptoms, and the etiology. In inflammatory lung disease, we find a high neutrophil count, for example, pneumonia.
Pneumonia is the result of the body's reaction to respiratory infections caused by bacteria, viruses, mycoplasma, and other pathogens. The infection causes an increased secretion of fluids and shedded cells to pour into the passages and air sacs of the lungs. The presence of exudate within the air spaces of the lungs causes the coughing, shortness of breath, and fever associated with pneumonia.
Obstructive lung diseases. Here the airways become reduced in volume or have free flow of gas impeded, making it more difficult to move air in and out of the lung. In the chronic obstructive pulmonary disease, this is mostly caused by smoking tobacco. It includes emphysema and asthma.
If you have asthma, your airways are frequently inflamed and swollen. Certain substances can cause your inflamed airways to overreact even more, resulting in an asthma attack. Since there is no cure for asthma, the goal is to prevent you from having asthma attacks by using long-acting anti-inflammatory control medications.
Respiratory tract infections. In the upper respiratory tract infection, the most common is the common cold. There are also infections of specific organs such as sinusitis, tonsillitis, otitis media, pharyngitis, and laryngitis. In the lower respiratory tract infection, the most common is pneumonia. It is caused by Streptococcus pneumoniae. The malignant tumors. These are responsible for 50% of all cancer diagnoses and 29% of all cancer deaths. These are attributable to smoking tobacco. And the benign tumors are relatively rare causes of respiratory disease. It includes pulmonary hamartoma and congenital malformations. Pertinence. Who are mostly at risk of suffering these diseases? Mostly the elderly. Why older adults are at risk? When muscles become weaker around the age of 55, older adults are unable to expel mucus, leading to infection and pneumonia. There is more exposure to toxins. Awareness is key. Thank you.